I was listening at the outset of the hour, and I want to say to the gentleman that I agree with him completely in regard to where does the spin stop. And, of course, Judge Carter said earlier, Mr. Speaker, that the spin stops at the Constitution. And he just commented a second ago, furthermore, the spin stops at the Supreme Court. And I think it's absolutely right, as Judge Carter points out to our colleagues, the Constitution in the Commerce Clause says the federal government can regulate commerce, but it doesn't say that the federal government can mandate commerce. And that's exactly the point, Mr. Speaker, that Judge Carter, Representative Carter from Texas, is making. He used some examples. I could throw out another and say, well, if the federal government can force people, maybe against their will and their ability to pay, to have a health insurance policy, why couldn't they go on and say, well, every adult male and woman between the ages of 21 and 64 has to buy cowboy boots?
Yeah, right.
And to take it a step forward, said not just cowboy boots, but cowboy boots that are made in the state of Texas.
It's a good idea, but
You know,
I don't think we can do it.
Yeah, maybe that's what President Bush would have said, since he's from the state of Texas. But Mr. Speaker, I think our colleagues get our point here. And I quite honestly, when 20 states, the attorneys general of 20 states join in bringing a suit against the challenging the constitutionality of this provision that actually mandates commerce, and they represent in the aggregate, those 20 states, what, about 40% of the population? And then you have the state of Virginia. Attorney General Cuccinelli is filing his own suit on behalf of the people of the Commonwealth. And in our great state of Georgia, Governor Perdue, Mr. Speaker, has asked our Attorney General to join in this suit, to join General McCollum in the state of Florida and these other 19 states. Our Attorney General, Democratic Attorney General in the state of Georgia, Mr. Speaker, has refused, even though the Georgia Constitution says if the governor is requesting that the Attorney General defend the state of Georgia, that the Constitution requires him to do that. But for whatever reason, I'm not saying it's political, but our Democratic Attorney General in the state of Georgia has declined to join in that suit. I would commend Governor Perdue, and that there are great attorneys in the state of Georgia who have agreed to file suit on behalf of the state of Georgia and its 9.5 million residents, the largest state east of the Mississippi, 5th largest in population in the country. We are going to bring suit, and it's going to be done on a pro bono basis. These attorneys normally charge $700 an hour for their services. They're highly skilled, very experienced attorneys, and they're going to do this because our Attorney General refuses to do it, unfortunately. But honestly, I want to hear further, Mr. Speaker. I thank the gentleman for yielding me time. He's the expert. Judge Carter is an attorney and a judge for over 20 years. He's the expert. But I really think, and I want my colleagues to hear this, I think that the Supreme Court could vote 9-0 on behalf of, in favor of these 20 states that are bringing suit against the constitutionality of this provision, mandating commerce, forcing people against their will to engage in commerce, as Judge Carter has said. So I hope that it will be an expedited review, Judge. I maybe not using the right terminology,
right,
but and hopefully within a year and a half that this thing will be settled. And colleagues, what that will do is it will unravel Obamacare. It will unravel Obamacare because to make try to simplify this, this thing would never have worked. Do you think, Mr. Speaker, that the health insurance plans, AHIP, these big insurance companies like Aetna, Blue Cross, Cigna, you think they would have agreed to cover people with pre-existing conditions at standard rates if they had not been given this deal? They went over to the White House a year and a half ago, Mr. Speaker, along with the American Medical Association and the American Association of Retired Persons and Big Pharma, and there was a deal for everybody, Mr. Speaker, and that was a good deal for the health insurance industry, because they were going to pick up all these additional people who were going to be forced to purchase health insurance, and not only health insurance, but as Judge Carter pointed out, Mr. Speaker, they were going to be forced and are going to be forced to purchase health insurance that has first dollar coverage. You think there's any plans ultimately to expand health savings accounts and let young people who are healthy, as the judge pointed out, and taking care of themselves and exercising, doing all the right things to buy a health insurance policy they can afford, one with a high deductible but a low monthly premium, and it has catastrophic coverage? They're not going to be able to permitted to do that. They're going to have to get these first dollar plans by 2014, and they can't afford it. But again, I thank the gentleman, Mr. Speaker, for allowing me to share my thoughts. My colleagues, I think, know that I've practiced medicine for 31 years, and I know of what I speak in regard to the American people being opposed to having the federal government come in lock, stock, and barrel and take over 1/6 of our economy, to make decisions that should be made in the sanctity of the exam room between a doctor and a patient. I thank the gentleman. I'll yield back, and I'll look forward to the rest of his comments.
Thank you, and I'll reclaim my